I wanted to talk to you today about male pain syndrome, which occurs with testicular prostate or penile pain, and it happens with very small injuries, or you're not even aware that you've injured anything, but you develop this pain. And it's a non-infectious pain, and so most of the men go to the urologist to check it out, which is a good thing to do. And then it is really an orthopedic problem because the pelvis gets out of alignment. And once the pelvis can be in alignment and stay in alignment, then the pain decreases and goes away. Michael has had this issue, and I'd like for him to tell you about it.
Yeah, for sure. So about 3 years ago is when all this started, and I started to have pain in the testicles and really in just the pelvic floor area. I didn't really know what was going on, so I went to a urologist like you said, and he examined me and everything seemed fairly normal. He said, you may have a varicocele. So we did an ultrasound, and there is one, but it's pretty small grade of a varicocele, which is just like inflamed veins really around the testicles. So it wasn't supposed to cause all this other pain and issues and everything. So what I wanted to do from there is just stay off of my body, not do a lot of exercises and movement, just let my body heal itself. Over time, it just got worse and worse and worse. And there was a lot more pain in like the perineum and the pelvic floor. It got so bad that I just really couldn't do anything normally. I had trouble standing up or sitting down for long periods of time. I couldn't exercise anymore. If I tried to run or just do any exercise, there'd be a lot of pain. I'd just have to stop. So everything stopped in my life, and I tried to do some things here and there, and I did yoga and tai chi and small things to get my body moving again, and I tried to heal myself in different ways, read lots of books. Of course, I visited multiple urologists. I tried to do the anti-inflammatory prescriptions and all those things first. I did all the normal industrial modern medicine first, which did nothing, just had some side effects. And then I went on a path of trying to heal myself, and a lot of things that seemed to work sometimes, but then I digressed. And then I'll get a little bit better, and then I'll digress. And it was just getting so bad that, I have 2 young kids. I couldn't even play with them. I couldn't go anywhere because I just wanted to lay down, basically. And I was completely not running, but changing my life dramatically. But after a couple of years, and I finally, considered physical therapy, and I read some books about it and started doing some of the exercises at home, such as I tried doing Kegels, for example, but I was so hypertonic and overstretched or over-constrained and contracted that the muscle was extremely weak. And so I found that out. So then I started down training, which is sort of trying to relax those muscles a lot and get more control over them. Did a lot of things like that. And I finally decided I'm going to look for a physical therapist that specializes in this. I looked online and found Tina. I found Fyzical. I saw she's had a lot of people that she has helped in this area. And I was like, well, I'll do whatever it takes to get better. I mean, anything that she asks, anything we can do together, I'll do anything to change this and to finally have my life back on track. And that's what has happened. So, I started coming here.
And so at this point, he's about 85% reduction in pain, and he is staying much more stable in his pelvis. And so once he gets completely stable and he can resume all his exercises, he'll be at 100%. And so we just want other people, other men who have these issues, to know that there is something that can be done to correct it and give you your life back.
Absolutely. I just want to say that I'm doing this video right now and telling my story because I'm absolutely ecstatic to have met Tina and to be able to come to these sessions. I've been coming for 2 months. Just like a couple weeks ago, I ran 2.5 miles with my wife. I mean, I work out every day now. I'm much, much closer to normal again. It's incredible. Everything in my life is higher energy. I'm doing things again. I'm much happier. I'm finally being able to, live a life again. So that's in 2 months. That was a ton of progress really fast. So many things such as, electric stim and myofascial massage and realigning the pelvis and things that I didn't really consider, such as that it wasn't just the pelvic floor muscle or the BC, I believe it is. There are many other surrounding muscles that got really, really weak over time since I tried to not do anything at all. I tried to not do anything, so my core, my inner and outer thigh, my glutes, my lower back, they all got extremely weakened, which created even more problems and got me even more out of alignment.
More instability.
So rather than trying to help myself by doing nothing, it got way worse. And that's something I just didn't understand. And hopefully, if you're watching this video, you're learning that. And I highly urge that you would go find a physical therapist, whether it be if you live in the area to go visit Fyzical and Tina and her team, or anywhere that you do live. This is an excellent option to really get help and to attack it from lots of different ways. But I'm really thankful to be getting better, really. That's what I wanted to say. Really thankful.
Okay. And I'm so glad you're here.
Yeah, absolutely.